Hey there and welcome back. Today we'll continue talking about the primary management strategies of pelvic ring injuries. As we mentioned before, the primary management depends on two variables, the stability of the patient and the stability of the pelvic ring. We then divided those patients into four categories. One more point we need to mention: an unstable patient with unstable pelvic injury. If embolization cannot be performed and bleeding persists, pelvic packing in the OR is our next option for hemostasis. In the second category, unstable patient and stable pelvis, we follow the usual pattern of resuscitation for the patient. Moving on to stable patient and unstable pelvis, after achieving primary stability as previously mentioned, close monitoring of the patient for 24 to 48 hours for the possibility of latent hemorrhage. And finally, for stable patient with stable pelvis, treatment either conservative or operative accordingly. Don't forget associated injuries of the pelvis. LC1 and LC2 are more commonly associated with head injuries. LC3 with bowel injuries, and APC3 has the highest requirement of blood transfusion and shock. That's it for today, and as always, thanks for watching. Till next time.